we're continuing to look at the concept of relational motion. So one thing moves in relation to another. So one thing stays still, one thing moves. So if we were to look at the coxofemoral joint, another way to explain it is we look at how the pelvis and femur are interacting with one another at the acetabulum. You'll get some people who like to move the thigh or the whole leg, internal external rotation, just like that. You may have some people, and now usually they'd be standing at the end of the foot, but my back would be to the camera, so I won't do that. And you can get some people who will move in this fashion, so the whole leg. You'll get some people who will come up and do hip flexion, and depending on what you're trying to accomplish, this may be more appropriate. And you can move the femur in relation to the stable pelvis. So the patient's on his back, the patient's in supine, the table makes stable. So in a relative sense, the pelvis is stable right now. So what we can do is we can again move the leg in relation to the pelvis, or the femur in relation to the pelvis. Or what we can do is we can stabilize the leg, and then we can have the patient create a situation whereby the pelvis moves in relation to the leg. Okay, so this is, if you're just paying attention to the patient's foot, what we're going to have him do is push this leg on the table and let go. And we get some relational motion, so we get a little bit of creep. Now remember that we're on barrier here, so we're not going to get a gigantic amount of motion out of this. Now we push down again and let go. Okay, so we get small motions. But essentially what we're having the patient do is push the pelvis into the table so the pelvis rocks on the table while keeping the thigh stable. Okay, so we can go ahead and we can do that over here. So we go into essentially external rotation while also putting the adductor mass on tension. This may not be perfectly visible because his pants and my top match pretty well, but what we're going to do is you're just going to try to look in this region to look for tipping while I keep the leg stable. Okay? So push this leg down on the table and let go. Okay? So there should be a visible rise in this ASIS. So if you're paying attention right about here, this should come off the table slightly, and then I should gain a little bit off of this leg. So push that other leg down again and let go. So in a relational sense, I gain. So as he pushes the leg into the table, the pelvis tips in relation to the stable femur. So again, the concept of relational motion, what I'm creating, the situation we're creating, is a stable femur, and then as the patient pushes the opposite leg into the table, the pelvis begins to move in relation to the femur.